Hello, welcome once again to Moorgate Andrology. It's great to be with you. It's David Mills here. And today I want to talk about a subject that crops up all the time when guys are thinking about penis enlargement surgery. And that is whether or not to have a circumcision after the procedure. So, this really relates to the girth aspect of penis enlargement surgery, not the lengthening part, but the part of the surgery that makes the penis thicker. And as you know, the gold standard way to increase penis girth is with a fat transfer. Fat is harvested from either your stomach or your inner thighs, where we have the best quality fat, and then it's put through a purification system that takes blood, oil and debris from the fat before it's injected into the penis shaft. Now, at Moorgate Andrology, we do quite a big fat transfer. And we do that because we know that even though we put the fat through this purification process, about 30% of the fat will absorb in the first 3 months after the surgery. This is a natural phenomenon, and it will always happen. However, after this initial absorption, the remaining fat will survive. And that's why most guys who want to have their penis made thicker will choose a girth fat transfer. Now, as part of the recovery process, guys who are not circumcised often find that their foreskin becomes a little bit tight, and it's difficult to retract the foreskin over the head of the penis in the first few weeks. And normally this will improve little by little over the first few weeks after the surgery, as you try to retract it to the point where it's too tight. Just try that a little bit each day, and you'll find that it will steadily improve as time goes by. Now, in rare cases, and I emphasize this is rare, the foreskin does indeed not retract. It's very tight. And the reason for that is that the fat finds its way naturally to the foreskin. There is no border between the shaft and the foreskin. And because the foreskin is very soft, it's very easy for the fat to settle there and cause this tightening around the head. And if it doesn't settle down, after more conservative treatments to try and break down this fat, we may need to do a circumcision, and this solves the problem immediately. Now, obviously, if you are circumcised already, then you cannot have this problem. You cannot have this problem. And the results of the surgery tend to be better in circumcised men, because you can't have this complication with the foreskin, and we can get the fat a little bit lower down the shaft. That's why at Moorgate Andrology, we offer all patients a free circumcision at the same time as they're having the girth fat transfer. Now, it's not a prerequisite, and I want to say here and now that many men have a very successful penis enlargement surgery when they're not circumcised. So it's not something you have to do, but our urologist will tell you that if you are circumcised, A, you can't get that complication, and B, the results do tend to be a little bit better. So when you're considering penis enlargement surgery, if you are circumcised, well, you can look forward to a very, very good result. If you're not, then a circumcision is something that you might want to consider as part of the overall girth surgery. I hope that's given you some idea of whether to choose to have a circumcision. Of course, many guys do have a circumcision not because they simply want to be circumcised. They'll choose the opportunity while they're having their penis enlargement surgery to have a circumcision done. You know, they either because they like the look of their penis when it's circumcised, or they feel it's more hygienic, and you know, or for religious reasons they have it done, and sometimes because their partner prefer them to have a circumcised penis. So all those factors are also going on and influence the decisions that guys take when they come for penis enlargement surgery. Well, that's all from me for today. I hope that's given you some insight into circumcision with penis enlargement surgery. If you'd like to know any more, please do get in touch with us here at Moorgate Andrology. We're always happy to have a chat with you and answer any questions you've got. But until next time, that's all from me today. I look forward to seeing you here back very soon. Bye for now.